Hi everyone, welcome to another Literacy Friday session. Today we continue our series about tips for helping struggling readers. We were at tip number 2 in our last session, which says treat the issue. And I highlighted that we should treat one issue at a time, and we must be mindful of the fact that each problem could be of a different nature. So we have to ensure that the approach we're using is able to treat that specific problem. As promised, for this video, we're going to delve a bit deeper in the different approaches that we can use for treating literacy problems, whether it be the clinical approach, the remedial approach, or the corrective approach. So in today's video, we're going to look at the 3 approaches that can be taken in treating literacy behaviors which are within struggling readers. So there are 4 literacy programs or 4 literacy approaches or reading approaches, which are clinical, remedial, corrective, and developmental. However, we're not going to look at the developmental literacy program today because that one is not particularly geared at struggling readers. I'm going to begin by looking at the simplest approach, or what we might want to consider the less intensive reading program, and that is the correcting reading program. If you have not yet looked at tip number 1, I would advise you to check out that video because that focuses on diagnosing the problem. So once we have diagnosed the problem, it's time to treat the problem, but we need to learn about the different approaches to treating the problem. With corrective reading, we're focusing on systematically developing the learner's fluency and decoding skills by correcting errors that the learner has been making. Now, these errors that we're correcting are specific to words, word associations, and confusion of no more than 2 phonic elements. And I'm going to explain. When we say systematically, with corrective reading, there is no rush per se to say you must get this correct in 4 weeks, but the emphasis is on correcting the errors that the child has been making between words and word associations or phonic elements. So with corrective reading, it would appear as if the learner is not faced with many issues or that the problem might not seem major, but just one simple error can be causing a major problem with fluency and comprehension and decoding. For example, if a child has no understanding of punctuation marks, in particular the full stop, the commas, the exclamation mark, and the question marks, then he or she won't know how to use proper intonation while reading. He or she will not know how to use proper intonation when reading, and that will in turn affect fluency. However, that's just a matter for correction. It does not require any intensive intervention. If the child is confusing the sound O with the sound O, meaning the letter O, and the short U sound, that would create issues with fluency when the letter O or the letter U appears in a word. And as you know, all words have a vowel sound, and the letter O appears quite frequently in words. Another popular problem we see with learners who require corrective reading is this matter of frequently misused words or frequently misspelled words as well. So they may not be sure of the definitions because they keep confusing words that seem alike or sound alike or are spelled somewhat similarly with just a difference in probably one letter, or even homophones and homonyms. So you just have to work on those things. So if it's a homonyms issue, you just work on homonyms for a period, and once you realize that the learner has now grasped it, you move on. So the idea behind corrective reading is that once the errors have been corrected, then the learner should be functional at his or her grade level at the time. Corrective reading approaches can be incorporated within the regular whole class setting. That's simply because it's not deemed as a major issue. It could be something was taught and the students aren't grasping it so easily, so you just do a follow-up lesson, and maybe that one lesson might be able to correct it, or just for a period, not probably more than say 6 weeks, and you're just working on that issue, and that's it. So it's not intensive, it's just fixing the errors. I must point out that corrective reading programs are normally offered to children at or above grade 3 level, because you at the grade 3 level you should have mastered those fundamental literacy concepts and be able to know the differences in things, so it would be easier for an instructor then to point out that this is an error and for you to deliberately correct it. Also, at that stage, the brain should be able to process the correction easier by unlearning and then learning the correct concepts. Below the grade 3 level, a corrective literacy program is not necessary and not recommended at all, because below the grade 3 level, such learner would just be developing those fundamental literacy skills and would just have been receiving those building blocks for literacy. So thereafter, it's just believed that it's now time to correct this if it is still an issue, because you should be able to manage. Remedial reading is now a small group approach or an individualized way of intervention. So it has to be individualized, one-on-one or small group, and it should also be short term. And when we say short term, we're looking at maximum 12 weeks to treat a problem. Maximum 12 weeks to treat a problem. Now, I know you may have known of persons who have been in remedial programs for months or years. Sometimes the program is going by, say, a false name. It's not really a remedial program. If it has to be running for over 12 weeks, it's not really considered remedial. It could be an intensive program that has remedial approaches. Frequently asked question: what do you consider as a small group for remedial reading? My recommendation: no more than 8 persons. I know it's not easy to get a group that small, usually, especially if it's not done privately where you're funding it yourself or a parent is spending for that sort of intervention, but no more than 10 persons should be in a remedial reading program. So my recommendation, 8 maximum. If you really can't avoid it, do not exceed 10. It's best to have 2 small groups of 5 rather than have a group of 10, because the whole idea of remedial reading is to get as best as possible one-on-one attention to the learner, so that those issues that the learner has presented are able to be corrected in as short a time as possible. And with remedial reading, it's normally a case where the learner is dealing with multiple issues. Now, it is understandable if after mastering one concept in the program, the person is able to move on to a next concept. And if it has to exceed 3 months, then it should not be that the person is learning the same concept for over the 3 months. In 3 months, they should have mastered at least 1 or 2 of the concepts that they were not previously able to master, or the skills that they did not previously have. The next thing that I must point out is that remedial reading is a supplemental program. So it is supposed to basically add to what has been taught in class, or what is being done in class, or what was done at school, and provide reinforcement. For example, if the learner is struggling, as in it has been diagnosed that this is a struggling reader based on the specific behaviors that were noted, then if the teacher is looking at picture walks as a strategy for improving reading interest and comprehension, then in the remedial program, that same strategy can be used to just reinforce what was being done in class, or even that could be a different approach to build reading interest. So if the teacher is focusing on reading interest in using one strategy, another strategy can be used in the remedial program. Another question I tend to get is, should I allow my child's teacher to also be his or her literacy coach? There are multiple reasons why I don't endorse such practice, to have your child's classroom teacher also be his or her literacy teacher. One great concern I have about that is whether or not the classroom teacher is a literacy teacher or a literacy specialist. If the classroom teacher is not specializing in that area, he or she may not be able to offer the best assistance to a struggling reader. My next concern tends to do with whether or not the classroom teacher has been using proven strategies to encourage literacy development. Simply put, if the teacher is not trying to assist the child in the regular classroom hours, why should you bother to spend for your child to be with that teacher for even longer time for specialized instruction? Now, I understand too that some teachers, despite not having the background in literacy learning, they are quite capable of doing the necessary research and showing the level of care necessary for struggling readers. So they may do excellently at guiding your child. Sure, by all means, enroll your child in extra lessons for reading. However, ensure that it is on a small. Another question I'm frequently asked is, why is my child's private reading tutor teaching him the same thing that is taught at school? Why I'm paying for extra help? Why is there nothing extra being taught? Totally new information, new skills, new concepts are features of a developmental reading program, not a remedial reading program. So if the child is reading below his or her grade level and having multiple issues, then the private reading tutor will not incorporate anything above what the child is already supposed to be doing or what the child has already mastered. So if the teacher is doing one thing in class, a remedial program will not bring the child ahead of that. The learner will first have to master the basics that he or she is missing currently, get out of that remedial program, get to his or her grade level, and then move into a developmental reading program. Now let's move on to the clinical reading program. This type of intervention begins with clinical assessment, and treatment of the issue or issues involves special care, specialists, and a specialized plan of action, and may include medical assistance. It does not have to include medical assistance. Now let me break this down a bit. So clinical assessment refers to assessment that is done by a specialist in the field. So it could be a literacy specialist. However, some doctors are able to diagnose literacy problems. Some counselors are also able to detect literacy problems or detect problems that can lead to undesirable literacy behaviors. So once such sort of assessment has been done, the next thing is to develop a specialized plan of action. A literacy specialist or a literacy teacher can create a specialized plan just for that person. Now, when I say it's a specialized plan of action, it means that if it is created for Jane, it cannot be used for Ben. And if it is designed for Ben, it cannot be used for Peter, because it's specific to the needs of the person's background, etc. In fact, in reading assessment, we actually do a background check, and that personal profile of the learner also determines what approaches we may or may not include in this literacy program. So with clinical reading intervention, the program is more intensive. Now, when we say may or may not include medical assistance, we know that some problems are directly as a result of a medical concern, a disability, a learning disability could be, or a physical disability, or it just could be something in terms of genetics and it just needs to be sorted out. It could be a matter of just lethargy, and if that's the case, then we just need to figure out what sort of diet this person needs to go on that would assist them in terms of their reading behaviors being improved. So yes, it takes a whole lot in concern. Some persons are struggling readers simply because their nutritional needs are not being met. So if it's just a matter of speaking to the family to say, listen, at the end of the day we have or reading sessions, but if your child doesn't have lunch throughout the day, he or she will not be able to keep up. Or it could be that reading is the first session for the day, but the child is just not motivated simply because he or she has not had breakfast. And if you take all that into consideration, yes, you are seeing a undesirable behavior during your session, but upon assessment, you may find that, listen, this is a nutritional issue that's causing this child to behave this way. In another learner, it could be a matter of psychological needs not being quite met in the way that the learner expects. For example, child was going to one school and went to that school for 5 years, and now it's time for primary school or a higher level. And suddenly the new environment becomes like a culture shock to the person. So they're just not responding to the new teacher or new teachers. So if that problem is not treated, then it just continues for years, and then it manifests as this person is now a struggling reader, although in previous years the child had no issues with reading. Or in that period where the child is just detached from the new teacher, then the child will not learn what he or she should be learning in that period. Then sooner or later the learning gaps are presented. However, if such is diagnosed and treated immediately, even through counseling or behavioral therapy, then that struggling reader can no longer be struggling. Simple as that. That's all for today, folks. Join us next week for tip number 3. I hope that this video has been informative and it will go a long way in helping someone. Thank you. Tune in next week when we move on to tip number 3 in this series.